caution. Your paradigm is about to shift at the intersection of fact and reason. You're entering Kingston Country.
I'm Dan Kingston, and you're listening to the Dan Kingston Podcast. Okay, Tim, our conspiracy theory expert, is joining us again today to talk about the World Health Organization declaring this a global health emergency today, and yet they're stressing confidence in China. Why are they stressing confidence in China, Tim?
Well, Dan, it's always a pleasure to be on your show. I don't know. I think this is the Chinese way of reaching out for help. I think there's been some back channel communications going on. China's said, okay, all right, we're in over our heads here. We need some help internationally.
That's scary, right? Because they're a big culture about saving face. And when they say, I need help, that points to something scary, right?
Yeah. They're saying, guys, we screwed up. We really did. The World Health Organization finally declared, that it was a global emergency. And for the record, this is only the sixth time in history that they've ever done that. That was kind of an eye-opener for me there. I was like, whoa, this is the sixth time, and I don't know how long the World Health Organization has been in existence, but I can imagine, it's been around for some time now.
Yeah, that's a big deal. I heard Ebola actually is also right now technically a health emergency in the same category. Is that true? Did you hear that as well?
I have not, but I imagine that they keep Ebola on the list all the time.
The difference is we don't have Ebola in the United States right now, as far as I know, but right now there's 6 cases of coronavirus in 4 states, and the first person-to-person case transmission in the U.S. was reported in Illinois. So I guess that's the difference. It's more impactful for us, right?
I think it's been here, Dan. I'm starting to think that this has been swept under the rug for a while, but but I think the virus is mutated, and it's spreading faster than they thought it would. I think that it's been in the United States for some time, but the reason we haven't seen or heard anything is because of our healthcare system and our hygiene in the United States is much more advanced than it is in, say, Wuhan, China.
Right. People, when they get a cough that doesn't go away, most people, if they can afford it, they go to a doctor, and we don't have a situation where we have to wait outside for hours in the rain just to see a doctor for 2 minutes.
Yeah, that's it. That's absolutely correct. In the United States right now, it's flu season. So you start feeling like crap, you're automatically going to think, well, wow, I got the flu. That's another reason we may have not, gone to the doctor and said, hey, what is this?
Here's a scary thing, though, Tim. Well, before that, there's a video of somebody puking up blood. And if it's been here in the United States, that's a fake video?
It's a fake video, confirmed. I found that video yesterday. I was like, holy crap, we're going full Walking Dead here. And,
how is it fake? How so? Was it a different disease?
Because it was actually dated. The video date was, I think, like 2 or 3 years ago. It's an old video.
That's what we warned about the first call that we had, and we were talking about you can never tell for sure. You got to look at the dates, so I'm glad we corrected that.
Yeah, you got to look at the dates on the videos. Some of the videos that I've seen where folks were falling over and everything, that was recent.
Right.
Have you seen the video of the Chinese authorities barring up the doors?
That's crazy.
On the contaminated people.
Oh.
I don't know what to think about that just yet. I don't know if it's all the way real, or if they're doing it kind of like, a PR stunt to say, hey, if you're sick, don't come out, or if you do, you better go to the right place.
A poor bastard who's stuck in that house, if he doesn't have water or food, then he's just going to basically, they're sealing him to die.
That's right. Here's your tomb. And there was a video of, there's another thing that gives me hope about this. And that's one thing that sometimes I don't express very well, is the hope in this. I think there was a video of a young lady being told to get into an ambulance, and she was suspected of having the coronavirus, and she was very hesitant. She didn't want to go. But they didn't pull out a gun and say, get in the van either. You know, they didn't look like, you know, Nazi Germany or anything. It was actually doctors convincing her to get in the van, paramedics, not the police or soldiers. The Chinese haven't resulted to that yet. If we start seeing videos of people being put into ambulances by soldiers, then we know, oh crap, this has gotten real out of hand.
Well, I worry because
the
fact they have concentration camps, they throw people off buildings in Hong Kong, and they've worked hard to have an image of, why can't we all be more like China? China's the future. China's so great. And then something like this happens, and we see kind of the reality of what Chinese the culture represents. But listen, there's obviously beautiful things about Chinese culture, but the government in charge right now, I mean, I'm worried about that. So the cruise ship, did you see the cruise ship? 6,651 people on a cruise ship stuck there?
I saw that. In Italy, yes.
What do you make of that?
They have also canceled all flights to China.
They're being really conservative about this.
Yes, they are. I mean, my theory about that is pull 10 people at a time off the cruise ship, give them, you know, top to bottom medical evaluations,
right,
and send them on their way.
Yeah, I mean, come on. You can't leave them on a cruise ship when you know that virus is...
You can't leave them on the boat.
Yeah, it spreads so quick. If God forbid it's spreading, they're all going to be infected in a matter of days. You have to start taking them out. Do what you can. I mean, Jesus, they're human beings.
You know, it's kind of like the Ellis Island in New York when people were immigrating to the United States. That was the whole point of that island, is if you came over to the United States, you came off the boat, you were quarantined there to make sure you didn't have any infectious diseases or anything like that while they checked you out. That was the whole point of that island.
But they didn't have the medical technology we have today where you can scan people and see if they have a temperature. And then also if someone gets sick, you know, they can do checkups at their house. Or, you know, this isn't a fascist society. You know, if you say, hey, if you're getting symptoms, go immediately to the hospital, people are going to do that in this culture. They're not afraid of a tomb like China, like a Chinese hospital tomb, right?
I wouldn't want to go to a Chinese hospital. But anyway.
yeah, but you'll go to an American one if you were feeling sick, wouldn't you?
Yeah, I'll go to the urgent care on the side, you know, down the street.
Right.
That's
Exactly.
That's where I'll end up anyway.
Right.
I mean, I live in North Carolina. We've got some very top-notch hospitals in North Carolina. So, I mean, if it's going to happen, I've got Duke Medical Center within an hour and a half drive. So I can, you know, hopefully get some kind of answer there.
We're very blessed because of that.
Oh, I know. It's, I think that Americans take that for granted. The one thing that still worries me about this virus, there's two things that really concern me. One is the incubation period inside of a person before it shows any symptoms.
Right.
You're looking 10 to 14 days before this thing even shows its nasty face, before you start coughing or feeling bad. The second of all is how easy it spreads. And there is a third thing, 18% fatality rate.
That's high.
Now let's think about this. Let's put this in small numbers. That's almost 1 out of 5.
Where did you see that 18% rate?
There was a couple folks that were out there on the internet. I've also heard it on a couple talk shows that it's 18%.
It's a high mortality rate.
Yeah, I mean that's crazy. If you think 18%, that's almost 20%. That's one in every 5
I heard that some researchers are working on an antibody test that they could give it to you before you show any symptoms to see if you have the virus in your body. But now that antibody test is being based on a coronavirus sample being provided by China. Why are we trusting that China is giving them the accurate virus? It's actually from Wuhan.
I don't think the Chinese have a choice right now. The Chinese need help. I think that they're just trying to save their own skin right now.
So you do
They're
trust
gonna
them
do
that they would give the right. They're not trying to still save face. You don't think that's a possibility?
I think that we would compare it before we did anything with it. They would give us a form of that virus, and they're going to take that virus to a lab. They're going to examine the hell out of it, and they're going to say, okay, this is the same thing. This is what we think it is, and move forward. But here's the thing: to do a vaccine, you know that it would take months before even the first human trial. And you're looking at possibly a year before it could actually be implemented into the population. A year, Dan. I mean, this is how unprepared we are for biological warfare, for biological incidents. If there's anything we learn, that should be the lesson here. How unprepared are we for this? I mean, and I guess the silver lining here is maybe this thing isn't like a pissed-off version of Ebola, because we would really be screwed right now.
Why isn't Trump stopping the flights?
I think Trump's not trying to. I think behind the scenes, the federal government is working hard. They're trying not to cause panic. I think that they're at the point now. They're like, okay, we're not going to cause panic, but you need to be concerned. You need to keep your eyes on this.
Look,
wash your hands.
Is the real concern the mortality rate, or the fact that if China's economy were to collapse, the entire world's economy were to collapse, we're going to look at draconian cuts in the U.S. because they buy our debt. They finance our way of life.
They do, and I'll get all into the finances and the Fed and all that.
Yeah, let's get into it, because I'm concerned about that.
The money's the real reason that you're not seeing it blasted all over the news in the United States. Because they know what it would do to the economy right now if they said, hey, your goods from China might not be shipping right now to us. That's going to cause some real problems on Wall Street. You got to think, that could collapse Amazon. How much Chinese crap is sold on Amazon? I mean, it would tank them. And don't think for 1 second that these boardrooms aren't sitting here looking at this thing going, you know what? Nobody talk about it or act like it doesn't exist. Just let it be. We're gonna keep making our money. The real problem is when the Chinese are too sick to work. I think it's going to be at the point where they're not going to be able to be functional. They're not going to be able to produce, and then they're too sick.
Well, even if it doesn't get to the point where you have millions of infected. Right now we have thousands of infected in China, more than in SARS. The idea is, could the fear itself be enough to stop Chinese workers from showing up to the factories?
No. Because the Chinese have a different ethic when it comes to that versus Americans.
They'll just show up.
They'll just show up
until they're too sick.
Until they're too sick, and they can't. I don't know, Dan. I think the numbers are fluffed here, and now there's reports of Russia having a case in downtown Moscow. There's a couple different folks I listen to, podcasts and radio shows, that are all talking about these preparedness food kits, and these people who sell them are sold out.
Is this sold in the U.S., like these dry food things that last 20 years? I have one of those.
That's correct. Yep, that's correct. There's I recommend My Patriot Supply. That's not a plug or anything. That's who I recommend.
Now, you can't give free plugs. They're going to have to pay us now. Well, you have the people here that are ready for the apocalypse. What do you call those? The preppers?
Yes.
Yeah, so we can learn from them, can't we? I mean, if God forbid it spread, those would be the people who would teach the rest of us how to survive.
Well, I'm going to tell you something about the prepper mentality that a lot of folks don't realize. The preppers will keep to themselves, and you won't know who they are. I don't know, Dan. I don't know where this thing's going to go. I think we give it another week and kind of review it.
I'm trying to get a doctor on here to help figure out this WHO World Health Organization declaration, exactly how alarmed we should be by that, and what a pathologist, or an infectious disease specialist would say. I imagine they'd have more calming words.
The one thing I do want to talk about,
Yeah.
and this is the conspiracy twist on this. So listen up, guys.
Yeah.
The professor that was arrested by the FBI at Harvard University 3 days ago, direct ties to Wuhan University. And what does this guy do? He recruits people in the scientific field to go work in labs in Wuhan, China.
You're talking about Charles M. Lieber, the chair of Harvard's Department of Chemistry and Chemical Biology, who was recently arrested by the FBI for his affiliation, lying about his affiliation with the Wuhan University of Technology. Now, you're saying that Wuhan University of Technology, that is related to the biolab?
Yes.
Oh.
It's a cover. And here's the best part. Let's think about this. What if some people have even said that they thought that this virus, if it was weaponized, it wasn't ready. Okay? What if there's a white hat, a good guy, somewhere over in China in that lab that released this thing to get them, stop them from going forward and weaponizing?
Wow.
What if it was really, and we put that spin on it and start thinking about it like that? What if some American was working over there that was from here, that was recruited by this guy who overseas, and they released it just because they knew they could get public attention on it and there could be no denying it?
Well, here's the problem, is that the researchers that have received the supposedly virus from China now for the antibody test they're working on say that it doesn't look like a bioweapon at all. And I don't know, I guess as a doctor, a scientist, you can tell looking at it if it's been engineered, I guess, unless it's mutated or what have you, maybe. But the question is then, they're putting a lot of trust in the fact that this virus provided by China is in fact the actual virus. So there's a question mark in my mind. Yes, I tend to think that China's reaching out for help. But isn't there a question mark that they're covering up some kind of deadly biological release, either was purposeful or accidental, wasn't ready, something happened, but that it is a biological warfare in disguise?
I think one of the cases is that it could have been espionage. I mean, it could have been a sabotage on the Chinese bio warfare.
So Charles M. Lieber is a good guy, you think, or a bad guy?
I think he's a bad guy. I think he's on the Chinese. He's on the Chinese payroll. I mean, honestly,
millions.
If it's proven that he was sending any kind of assistance to anybody in China who had anything to do with their military biological program, he should be charged with treason.
I agree, 100%.
That's the red-blooded American in me. I think that he should be tried for treason and punished accordingly. I side Adam Schiff. But anyway, that's a whole other side game. There's a whole other.
What do you want to leave us with the coronavirus?
The coronavirus, I say we need to give it another week. See what the response is. Let's step back. Let's see what happens here. Unless something drastic happens. I say let's step back. Let's watch this. I'm not backpedaling on this thing. I think let's step back and see if they get it exterminated.
I agree.
Yes, sir. I think that the impeachment is a whole nother ball game. I absolutely love what Rand Paul did today on another subject. I'm sorry, I'm changing the subject, but what Rand Paul did today was just absolutely brilliant. And if you're listening to this podcast, you should go to Rand Paul's Twitter right now and follow him.
Yes, because we can't say the name that he wanted to say, because who knows what Apple would do to this podcast if we were to start announcing forbidden names. But Rand Paul's a senator, and he can take that risk, and commend him for doing that. I've always thought him to be a stand-up guy.
Exactly. All right, Dan, you have a good weekend.
Thanks, Tim. We'll check in soon. Take care.
Always a pleasure. Thank you.
Kingston Country. You've been listening to the Dan Kingston Podcast.
Dan Kingston here. Are you fed up with the mainstream media? Do you want to support citizen journalism? The Dan Kingston Podcast is dedicated to asking questions and exploring topics the mainstream media won't touch. If you enjoy this content, would you help me give you even more for less than $1 a month? Yeah, less than $1 a month. You can help me do just that. And it's as easy as using Apple Pay or any credit card. And by the way, I'll be thanking sponsor names, your name, at the beginning of each podcast episode. So would you consider signing up for less than $1 a month? Find the link to become a sponsor in the description of this podcast episode, or visit anchor.fm/Dan Kingston. Thank you in advance for supporting citizen journalism and helping me provide you with even more content. I really appreciate it.